opening speech, which I would like to show later, share screen. So let us know. And then I just could probably read her opening speech for her on behalf of him. All right. Can we just start it? We already 6 minutes over, and then more than 30 participants, which is not bad. Yes. I don't know, most of them probably around, some of them are lectures here, might be master and PhD students. All right, can we just start it now? Is it okay to start now?
Are you happy, gang? You ready?
Oh, yeah.
Ready, gang?
Oh, good. Thanks.
Okay, thank you. Prof. Ridwan, apakah bisa Prof. Ridwan yang bacakan sambutannya padakan saya kirim?
Oh, boleh.
Karena saya sebagai moderator. Oke. Yep.
Oke.
Saya kirimkan ya. Yeah. Oke.
Dikirim di mana maksudnya?
Di WA tak, di WA tak.
Oh,
Langsung kita
okay.
kerjakan. Yep.
Wait.
Just wait a minute. Belum terkirim, coba sebentar. Yap, tapi Prof sudah diterima?
Ya, sebentar, ya. Oke, sebentar.
So the opening ceremony of the Dean will be read and delivered by Professor Ridwan, head of postgraduate school in here at FKM.
Oke, mulai, baca.
Mulai.
Baik, Bismillahirrahmanirrahim. Opening speech Seminar Dean of Faculty of Public Health. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning. Welcome to the Public Health Seminar Series. Distinguished speaker Dr. Gan Chen and participant and Dr. Rohan. Before we begin this webinar, on behalf of the Faculty of Public Health, I would like to express my deepest gratitude to all of you who sincerely committed to participate this online seminar. I will also like to express our sincere gratitude to our facilitator, Dr. Ga, from the Center of Health of Economics, Monash University, who is willing to talk over this school seminar on the topic Discrete Choice Experiments or DCA. I also would like to thank to Dr. Rohan Sweeney, who is conducting the DCA study in Makassar and is initiating this seminar. Dr. Chen will present an important topic on how people choose the option of maximal benefit or utility in recent years. This DCA has gradually become the most commonly used method to quantify population health preferences, public health workers, employment preferences, and other stakeholders' preferences in healthcare, so as to provide decision-making basis for policymakers. I expect Dr. Chan will discuss how to conduct the CI and how incorporating user preferences at the intervention design phase may be useful for enhancing the uptake of an adherence to complex health interventions. I hope our speaker could also outline potentially fruitful area for future research associated both with DCI in general and with health application specifically. paying attention to how the result of DCAs can be used in economic evaluation. I'm sure that you all will find new idea and will feel enriched with knowledge after completion of this webinar. I welcome you all once again to the webinar and hope that you all will have a great time ahead. Thank you all. Wassalamualaikum warahmatullahi wabarakatuh. Over to you, Anca.
Thank you,
Thank
Professor Ridwan, for delivering the speech on behalf of the Dean. Next, we move on to the main session presentation from Dr. Gang Chen on the topic of discrete choice experiment in healthcare. Just to let you know for the participant that Dr. Gang Chen and the college, Dr. Rohan Sweeney from the Center of Health Economics in Australia. Dr. Gang actually and then Dr. Rohan Sweeney are conducting DCA experiments in Makassar as a part of RISE project. As mentioned by Professor Ridwan, that this DCA is an important method for economic evaluation, which is important also for us because in public health, we need economic evaluation to choose which intervention actually is more benefit for all of the population health. Without further ado, I would like to offer Dr. Gang Chen's time and screen is yours.
Thank you, professors. Good morning, everyone. Thank you very
Dr.
much.
Chen?
Yes.
Yes, just to remind the participants, jadi Bapak Ibu sekalian, selama presentasi berlangsung, jika ada pertanyaan bisa langsung ditulis di kolom chat. Ya, kalau ada pertanyaan langsung ditulis di kolom chat. Nanti setelah selesai, saya akan terakhir saya akan melihat kolom chat untuk melihat semua pertanyaan. Semua pertanyaan bisa ditulis dalam bahasa Indonesia, bisa juga bahasa Inggris, tapi bisa juga bertanya nanti di sesi akhir. So I just to remind the participants that if there's any questions arise, they could directly write in the chat columns, either bahasa or English. Then I will come back later in the last session of this talk. Go ahead, Dr. Chen.
Thank you so much. Good morning, everyone. It's my great honor today to get this really great chance to communicate with everyone on using discrete experiment in healthcare. And my colleague Rowan, a few years ago, or maybe not a few, but a couple of years ago, offered me a really great opportunity to join one of the excited collaborative study here. And through that project, we gradually collaborating building of the collaborations, as well as we working with the staff student as well. So for me, it's a great learning experience. And for today, I guess we just wanted to share some experience we built working on this area using discrete experiment. We will cover some of the broad topic. So we probably wouldn't go too very detailed in each step, but we hope to cover some of the broad topics. And in the meantime, try to put in more reference and relevant, for example, softwares to the slides. So in case we need to know more details on any of these experiments and also relevant softwares, those are the good reference to be referred to. But of course, feel free to reach us as well. We are more than happy to chat and more than happy to collaborate. So let me hopefully I can click on the slides. If that works. Not quite. Okay. Yeah. So in brief, we put in 4 sections. The first one, I guess, is really the questions we always ask ourselves: why or when do we want to use DCE? And then we'll briefly introduce two topics, which rely on the previous experience that researchers have learned on how best to conduct DCEs, such that including how to design DCE, how to administer DCE online or using the questionnaire, the face-to-face interview. After collecting the DCE data, the next step, which is also crucial, is how to analyze DCE. So there will be also a few very good reference around this area. At the end, as I mentioned, I will probably put in a lot of these relevant textbooks, softwares, and relevant academia, which are really leading in this field, in particular on health-related issues, health preference research. So that is a brief plan. And if at some stage you cannot hear me speaking quite clearly, feel free to interrupt me. I'm sitting in the new room, which I'm not quite familiar with, so I hope it works. Well, speaking of the DCE, I think, as a matter of fact, regardless whether you have used DCE for your research or not, in the real life, we have been using or we have been completing DCE, similar type of DCE very often. So this is one of the website I really just logging on last night, try to search some phones, mobile phones, and this one just pop up. And you can see, which is very common if we do online shopping, whereas they give us a few options. And there is also a button. Here is a heart on the right top of each phone for you to tick. Or if it's online shopping, you can probably click the button, which will go to the payment web page. So this is also in the real life scenario, but it is also one of the very common format that we conducting the choice experiment for our research. One of the key things we can see from this slide is that here are different phones, and this website present us a few key message or key information that will help us to choose which phone we're going to buy, to purchase. For example, we can see probably the most important one. We just click on the website is the image, what does the phone looks like, and also you can see in the middle on the second row for the Samsung phone, they also got the S Pen there. It's got a pen, so it's quite distinguished from all other phones. What we can also see in bold probably is the price for the phone. We can also know is that the brand, which brand that is. For example, in the middle row, in the middle column, the one on top is TCL, and the one in the bottom is Samsung. So that gives us additional layer of information. So for researchers and for people who are in the marketing department, I think, before the new products coming to the market, it is very important for us to understand what factors really matters for the consumers. And those things that we're just talking about, like the price, like the brand of the phone, like the other, like the screen size of the phone, all these things potentially will influence our purchasing decision. So whether we prefer this phone or the other phone will be fundamentally determined by all these characteristics. Such that if we do the research, if we want to understand which factor matters the most, we will have different methods to ask for this information. We can ask respondents to simply rating the importance of each factor. For example, the importance of the brand itself, very important, somehow important, not important. We can ask them to rate the price. The price of the phone, very important, somehow important or less important. But to do so, it's still very difficult for us to understand. And people sometimes, we found, they always choose somehow important or very important. So you cannot distinguish the characteristics from those rating tasks. Whereas discrete experiment, which putting the whole product in one place and to make it very similar to real life scenarios, you make your choice based on the whole package of the whole program. From there, we can indirectly understand which characteristics really matters for you. So that will be one of the key benefits that within the discrete experiment can achieve, as compared to we just ask respondent to rate the importance. So to transfer this web page to an actual experiment that we sometimes used probably a few years ago, it wouldn't be difficult, right? We know the characteristics, and the only thing we need to do is to put that into the questionnaire. As one example, this is just really what I did quickly here. This is one of the experiment tasks. We have two options. One is form A, one is form B, which does not mean anything. It's just a label. Well, to describe the form, we will have a brand. We will have information about, for example, the camera, information about the screen size, the network, whether it can support quick charging. Of course, I made this up, or totally made this up. I think at the current stage, they are quite similar on all those functionings, but I just to make up these examples so you can see potentially when people making decisions, they need to see, they need to make a trade-off. For form A, it probably has supporting network, supporting 5G network. For form B, it does not support. It's only support up to 4G. On the other hand, the form B allows for quick charging, while the form A does not allow for that. The form A is Apple phone. It's iPhone, sorry, it's iPhone from Apple. So the brand itself may bring some information as well. On the other hand, it is more expensive. So between the two forms, there are a lot of similarities, but in the meantime, there are something different. So for the consumers or for your research participants, they will need to think about those information and to make indication which form they may more prefer, or may, for example, here the question is says, which form would you buy? As simple as that. So by collecting a series of these hypothetical scenarios, you will be able to understand the relative importance of each levels and each attributes. So let me just probably define two concepts. One is on the left-hand side, highlighted in red. This is the characteristic of the form. In the literature, sometimes we call it attributes, but it is pretty much just a different characteristics of a product or of a services. Within each characteristics, within each attributes, we will describe it using different levels. So for example, the brand, we have Apple, we have Samsung. In the previous slides, we see the TCL. So all those things are the levels. We know the camera, within the camera, we can have different type of levels. For example, you got two cameras on the left, or you got three cameras on the right. And also for the camera itself, it's different. So all those things consist of the levels for this camera attribute. So similarly, we will have display, network, whether it allows for quick charging, yes, no, price, etc., etc. So all those blue things are attribute levels. So pretty much that's it. So that's what we're looking at. It is one of the most classical discrete experiment we are working on. And in the good old days, and well, actually, at the moment, just because of COVID-19, it's less likely for us to do face-to-face interviews. So we now more shifting towards using online experiment, but still, quite often we will print out this choice task. We will talk to people and for them to tell us their response, and then we bring back the box of the questionnaire, and then we put that into a data Excel sheet and transfer that to, for example, status, SPSS, and before doing further analysis. So pretty much this table represents one of the experiments. And if you want to give a name, here I'm just using one of the definitions that are used in the literature, that a discrete experiment is an attribute-based survey method for measuring benefit. It's an attribute-based, which, as we see before, including all those characteristics of a product. And measuring the benefit here is utility, how satisfied you are with the different products. So that would be what you're trying to understand from your participants.
Gang?
Yes.
Yes, could you please speak a bit slow? It's
Okay. Yeah,
Thank
okay.
you.
Yeah. Will do. Yeah. So within the DCE, there are still some theory behind. And the first theory is economic theory of consumer behavior. So in particularly, let's think about the example before. If we make the choices, we need to assume that the product, the phone we choose, that leading to, for us will be we are more satisfied with phone A than phone B, based on your own preference. So for a rational decision maker, you choose the phone that you feel more happy with, you're more satisfied with. So that underneath this decision making, one thing is people will make rational decision. Although in the real life, we know sometimes that's not the case, but that is one theory underneath. The other theory we always heard about is random utility theory, which is very important because people making decisions, that's not always consistent. So you making decisions, I'm making decisions based on that choice task we see just now on the two phones. But there are a lot of other things we didn't show to you. We probably will tell respondents that please consider all other not shown characteristics to be the same between the two phones. But sometimes people wouldn't think about that way. They may bring in something that from their own experience. So in this equation, there's only one equation, I guess, throughout the whole presentation is very important one, is this U equals to V plus Ayrton. This Ayrton is non-observable, is not presenting to you. And the V itself represents the attribute and the attribute levels that you show to the respondent. So anything, if you don't show to the respondents, and anything respondents bring in when making their own decisions will be in the Ayrton. So in that sense, if I show you the same choice set in two different time periods, you may actually give me a different result, which depending on the influence, how large the influence from the Ayrton will be in making the decisions. And if you can think about, I asking a respondent a discrete experiment on a topic that respondents totally don't understand or not interested in that scenario, the Ayrton, those who are not observable, will play a very large role. So you may get all the different results in different time points. It's because the error term plays a quite important role. On the other hand, if the scenario you present to the respondents represents the most important characteristics, are the most interesting for this group, they are more likely to give you more consistent results each time as well. So for decision making, the U represents the utility, how satisfied you are with each product. So altogether, this is probably the only and the most important equation we will need to keep in mind when designing the DC as well as when analyzing the DC. So that's the only equation that is the most important to us. So let me move on to a few examples. So the DC has been increasingly used in healthcare sector. Of course, it has already been quite widely used in other disciplines, other areas, but for health, it is currently one of the most widely used. And if you see the number of papers published each year, you can see a very sharp increasing trend on using DCE. There are many papers that are using DCE in Indonesia. I didn't provide a whole list here. I just really quickly put in the PubMed and just to see what could be the topics that recently published in 2021 or 2022. As you can see, I only list 3 here. It is not a complete list, but we can see that the DCE has been used to understand the preference for pharmacist services to enhance medication management. It has been, actually all the 3 topics are about behaviors, to understand patients' behaviors or to understand how to attract graduates to working in certain areas. So underneath a health human resource area. So all broadly within the health system area. All those 3 topics are also the quite widely used areas for experiment. You want to understand how to improve patients' adherence to a particular clinical protocol. You want to understand how patients will be more willing to conduct a certain behavior. So all those things, before you do the clinical trial, DCE could provide some useful information for researchers to think about how to design the clinical trial. And for policymakers, for example, the last example, when we're thinking about health policy and planning, how to improve the doctors or nurse per capita in more rural areas, then DCE provide a good tool to help us, to help policymakers understand what will be the incentive you can provide. So the incentive does not limit it to the wage, the monetary characteristic, but also the non-monetary, not wage characteristics also plays a very important role. So these are a few examples recently published about Indonesia. And if I want to expand it slightly broadly, if you are very interested into understand how the DCE has been used in healthcare, a very good starting point would be a couple of early papers in 1990s by Professor Carol Proper, who we are very lucky that Carol also is part of the CHE as well. So she introduced the DC to the health economics back into 1990s, and a couple of papers published at that time is more in economic journals, like the Economic Journal, like the other example I gave here about Journal of Human Resources, talking about how the DC can be used. It's a very good paper, also very complicated. So even 20 years later, if you read the paper, you still have very detailed information that we can learn from it. Today, I wouldn't go to this paper in detail, and I'll use a few other examples that I was involved, so I know more about the background, why we want to do that, and slightly different areas. So you may see that DC can also be used in different ways. The first example is actually the first DC study I was involved. Is about we have these issues of, well, not only Australia, I guess aging is a global issue, and for the older adults to give up driving and using public transport will be one thing we have in mind to potentially reduce the potential traffic accident and to improve the safety. So how, before a new policy be implemented, how can what would be the potential policy interventions to help them or to more effectively help the old adults making decisions to give up driving license? The one thing I had in mind, I think, was, well, maybe we can make the bus ticket much cheaper. That's one way. Each time, I remember at that time, probably 2 stops or 3 stops that cost $4 Australian at that time. So it was quite expensive for me as well. So one potential thing we may be thinking is to reduce the bus ticket for the older population. Well, the other one is, we know the bus is not as frequent as we wanted. So maybe to increase more frequency availability of the bus to the older population, not only to the older population, but to the general public, maybe one way to do that to be. So we conducted this truck experiment, and then the truck experiment looks like this. It's based on paper, so it's a hard copy questionnaire that described very similar to the form example that we ask respondent to make a decision between the 2 scenarios. And after they answering a series of these type of hypothetical scenarios, so they are not the real scenarios, we just change the levels and we create these scenarios. We will be analyzing the data. And actually, the results, I wouldn't talk about detail today, suggesting that the 2 things I had in mind was not really the more effective way to do so. So the older population, they are more likely to give up driving if they are really lose their confidence on the driving, or if their doctors or the family members told them that you probably not fit to continue driving. Whereas the other interventions, such as provide more bus or to reduce the bus ticket fee, was not that effective. So this is one example showing that the truck experiment can help us understand what will be the potential policy intervention outcomes before the actual policy being implemented, which will also tell us how we can probably redesign the policy if we wanted to do so. So for the new policy or the new product, before it is on the market, the DC, it is one quite widely used method. In particularly, in the marketing department, it is very widely used. I will give one example in health sector. So this is one example for the vaccinations. And before this is a new vaccination, MB vaccination. Before it is developed, before it's on the market, so we have conducted this DCE. So it is not yet on the market. It is hard to know how people willing to pay to have this vaccination. So we designed the DCE and we conducted DCE with populations, with both parents and with adolescents themselves, because they are the people who are going to have this vaccination. The finding, so after conducting the experiment, we calculate the willingness to pay for this new vaccination before it's on the market. So we calculate it's going to be around $251 if adolescents themselves willing to purchase this vaccination. For parents, they are willing to pay more. It's around $300 for this to have this vaccination. A couple years later, the vaccination has been on the market, and so the final price in Australia is range between 250 to 500. So the final pricing is quite similar to what we provided to the public. So this is just another example to show that before a new product, whether it is vaccination, a new medication, before it's on the market, it is another way that we can use it to understand how willing that general public or your targeting respondents are willing to purchase for this new product. At the moment, there are many DC study papers looking at COVID-19 vaccination, for example, because this is also one of the crucial public health issues. So you can see a lot of papers on this area. I think for today, I kind of been trying to provide a few more examples, such that you can see whether this could be the area you can consider using the experiment. So please bear with me. I still have a few other examples. And this one on the screen, I want to show this one on two purposes. The first one is that quite often for the new health technology to be included into the government budget, we need to understand how to prioritize. So which type of the new technology should we reimburse with a limited budget, the government budget? So we need to prioritize and we need to understand how to do so. So type experiment here can be used in such a way to create a tool to help people understand how to prioritize. And here it's an interesting study in a way that we can see quite a different type of experiment, which called best worst scaling. I will show it in the next two slides. What's different from the one we have already seen quite a few times. So this is the one we have seen quite before from the mobile phone, from the driver license. While here it's very similar. We've got a feature which is attribute, and then we have intervention A or intervention B, and each of them are described using attribute and levels. So respondents were asked to say which intervention they more likely prefer to fund using the government budget. And from there, we will able to understand the relative importance of all these features. So for example, whether what's the age, for example, what's the age of the patient for this new intervention? Is it going to be an adult in the working age, or is it going to be a children, adolescents, or is it going to be the old adults? So all those information we can then understand, and then we can create a scoring algorithm to understand how to prioritize resources. In a different way, instead of using this discrete experiment format, people see two interventions at a time. We can also let them to see one intervention only. So they only see, for example, intervention A, they wouldn't see intervention B. But in that sense, we cannot ask them to choose between A or B, which is better. What we can do is that they see one intervention, and then we ask them to tell us within that particular intervention, for all those features, which features they think is the best, which feature they think that is the worst. So that is best, worst, the name of that. But in real life, it's not to say, you can also change not to use the best and the worst. You can say which feature you think is most important, which feature is the least important. So in that sense, you can still understand what are how people place the relative importance for a product or a new services in this case. So the difference is that each time you're facing with one intervention, maybe it's easy to do the task. And also another crucial difference is that here you are not comparing different services. So you are asking respondents to comparing the attribute levels among those features directly. So you can get more information across different features, allow you to directly compare, whereas in the previous example, not possible to do so. So it is another way which is gain popularity at the moment, in addition to the traditional discrete experiment. It has its challenges. It's not, sometimes when the new methods being proposed, people are very excited, but it also has its very challenges in how to analyzing the data set, how to interpret the results, and how to make best use both responses to the best option and responses to the worst option. So today I wouldn't go to in details, but just as a note, when we have the backward scanning data set, how to analyzing it will be slightly different as compared to how we're analyzing the discrete experiment data set. I'll give a final example here. It's also very popularly used by using the experiment, is how to value health, which then leading to as an important input into the cost utility analysis. We're probably working on health sector. We know this widely used quality of life instrument, such as EQ5D, SF6D. So all those preference-based instruments taking into account how people weight up between different health dimensions. For example, is it mental health more important than physical health for you? Or is it social health is more important than mental health? Or reversely, physical health is more important. So to understand the relative importance of health, the discrete experiment is a technique that gained really popular in the more recent literature. The formatting will be very similar to what you've seen before. You always have a different alternatives. So here on the left column, they have physical function, role limitation, social function. Those are the attributes we've seen before. And within each box are the levels associated with each features or each quality of life dimensions. And then respondents will choose among these two alternatives to say which health state is better. So after collecting a series of these health states and how their response to the questions, we will be able to understand the relative importance among all those dimensions, quality of life dimensions. And then we can create the scoring algorithm that to use for cost utility analysis. So it is a very popular area at the moment. And including the methods from my previous slides, using the best worst scaling method, it can also be used for the same purpose. It has some challenging to directly using for that purpose. For today, I will not go into the details. Recently, we proposed a slightly modified methods that can solve this issue. As you can see, the formatting is very, very similar to the health prioritization example. You show respondents one health status, and then respondents were asked to tell you which of these dimension and levels is most desirable, which of them is the least desirable. They don't want to be in that quality of life states. And then what we propose is after a series of these tasks, we're adding another set of tasks for unclean purpose. But the key thing will be similar is that the formatting is ask respondents to choose what is the best and what is the worst. From there, we can develop a scoring algorithm. So that is probably, if you're looking at the literature at the moment, this is one of the very popular area.
Gang?
Yes.
Oh, you might be about to discuss this. I've put a couple of questions in the chat.
In the chat box, okay.
No, but I'm interested. I put them in Bahasa on Google Translate.
Thank you. Thank you. That's
maybe Pak Ancha, do you want to?
Yes, that's very, thanks, Rohan. I also make a note about this and then attributes. I mean, it's up to you whether you can discuss it now or later, but this really important question. How did you decide which attributes are important, and then how many attributes?
Yes.
And also one question is, when we create a scenario, then you mentioned most of the scenario are hypothetical.
Yes.
How do we have to use a hypothetical scenario, or we try to find out previous example, which is the real situations? How do we decide it and how to develop scenario actually? Yep, go ahead.
Yeah, thanks for the questions. I think that's a very good question and also very good timing, because in the next probably 1 or 2 slides, I'll touch on these questions because they are really the crucial part of designing a discrete experiment. So maybe I'll reply to the questions when I go to the next couple of slides. Would that be fine? And also, Roland, do you have also questions?
They were the same questions.
Oh, there was some question. Oh, sorry. Yes. Okay.
Okay.
Okay. So in that sense, I'll go to the next slide and using one of the flow chart to answer these questions.
Right.
Excuse me, Chen.
Yeah.
I found there's a in my screen there is line scratch.
Oh,
I'm not sure
okay.
in my screen or somewhere.
Give me
I'm
a
not
second.
sure what
I
is-
think I can
They've
clear you
disappeared.
right away.
I
It's
read
gone.
this up
Just-
to now. I'm not sure whether it's only me or any other also participants.
Yeah, I can also see that. Now it's all clear, I think.
Hmm.
Okay.
Yeah, mine's clear again.
Okay, good. So I'll continue and to answer these questions. So for the DCE, the most important part probably will be before you collect any data set, because as soon as you design the scenario, design how you're going to collect data set, everything will be already set. So most of the time, we spend a lot of time to discuss how to design the DC. How many attributes should we use? What will be the attributes? What will be the attribute levels? And also, it is hypothetical scenarios. To what extent that should reflect the actual scenarios we're going to have in the real life? So all those are the very important questions before we do any empirical data analysis. To guide us, there have been a series of good research practice guidelines that we can refer to. So I will show a few of them today, and then let's see whether I can move to the next page. Okay, yes. And to follow those guidelines or checklist, it will help us do not omit, I guess, any important steps. I don't have time to go to each of these guidelines in detail, but these are all the papers I think worth reading in detail. In this checklist, they present a 10-item checklist, which in essential are the 10 key steps. So I will go through the key steps today, which is here. For the DCE, to use DCE or to think about using DCE, I guess the first question is to have a research question. Why you wanted to do that? What's the motivation? What answer you aim to achieve? So that will be the key question we should have in mind. For example, we want to predict what will be the most popular mobile phone to be sold. That could be a question. Then the attribute and levels selection will be depending on your research question. In generally, we see, for example, the attribute numbers will range between, I would say, probably at least 3. 2 will be a little bit small, but still sometimes people use. It could be as low as 3 attributes, as high as, well, there's not necessarily a up limit. But in the real life, I think most likely people will use 6 to 9 attributes. More than that is totally possible. What is the only thing to consider is when you're presenting the information to the respondents, we need to simplify it. So we need to use some advanced design method such that they only see a subset of attributes. For example, if you have 20 attributes in mind, you end up showing a 10 each time to the respondents. So there will be a design method that help you achieve this. Initially, it is very often we have a research question and we come up with maybe 20 or even more attributes, but we know not all of them are very important. So we need to narrow down to a more manageable and also important number of attributes. What we could do, and what we commonly do, is that we go through a few steps. What more directly is you're talking to your targeting respondents. So you can ask them to rank as easy as rank, or if not give a full rank, it just tell you that among these 20 attributes, probably which attributes are they think non-important from their perspective. And if you're talking to a few respondents gradually, you will get a sense about the relative importance from all these 20 attributes. You can potentially narrow down to a small number. It can be a focus group discussion for all the people to discuss, or for them to choose probably the most important 6 or 7 or 8 attributes. That could be the way to use. You could also potentially do a more formal analysis, which is similar to the best-worst scaling method, whereas the attributes will be the items will be the attributes. You don't have any levels, and people will do a series of best-worst scaling tasks. From there, you will understand what are the important attributes. And then all those information from qualitatively, the talking to respondents, or quantitatively, you ask them to rank, ask them to either simply rank or do a more complex best-worst scanning. All those information will help you to narrow down the number of attributes. Regarding to the levels, it's also quite difficult. We are sometimes looking at a new market, a new product like a vaccination that is not yet on the market. You don't know, there are a few things you don't know, like the costing, the price. So sometimes you also like to give the range that is a little bit wider. So from there, you can understand to what extent people willing to pay. But the attribute and levels itself, to some extent, it should not be too, I guess, different. To, if respondents feel that the task, the answering does not make sense, they will not be serious providing their answers. And then the result you're going to get probably will be biased as well. So viewing before you design the DCE, those pre-tests, those qualitative studies becomes a very important step. So that is on this flowchart, is on this checklist, is on the number 2 about the attributes and attribute levels. And then if you finalize the attribute and the levels, you can start to construct the task, how you're going to present the DC to the respondents. There are a lot of considerations. I will show one example afterwards. And then you need to think about how many tasks you're going to show to the respondents. Maybe 6, maybe 10, 20. Well, the highest, the longest one I put to the respondents, they probably complete 80 or 100 tasks. So that was more to understand individual preference. So it's quite different scenario. But if we are interested in at the population level, normally we will do, for example, 6, 9. Personally, I probably wouldn't push beyond 12 tasks before people get tired and they're starting to give answers with less quality. And then moving on to more detailed, how to put that to the platform, how to collect data face-to-face, or it's online survey, people can self-complete themselves. And then how to download the data set, clean the data, and do the statistical analysis. So really, statistical analysis in step 8, the checklist number 8, is really, it's already quite a late step. So more importantly, I think step 1 to 4 probably is more important in the DC. Afterwards, you can present the results and come up with your policy implications. So this is one of such checklists that is being widely used, with reference to. It has very detailed suggestion in the paper, so it is also highly recommended to read it. Actually, it's a series of good research practice. So the next one, for example, shown on the slides is the one that talking in particularly about the DC design, because DC design itself has a lot of it's not as easy as sometimes we think so. It has a lot of theories to guide how best to design those choice tasks. So it is also a very complex issue. There will be specific guidelines for that. And there will be, hold on. Sorry, somehow I lost my mouse and there's a pen shows up. I hope that will work. No. Okay.
Okay.
Yeah, now it goes. And the other papers is similar. It's very detailed guidelines on how to do it. So I wouldn't go to all those details today, but really just to let you know there are all those details, all those documents that help you to think about how to design the DC. What will be the sample size, for example? The sample size is always a tricky part for discrete experiment. You're almost very difficult to calculate the required sample size before you're actually conducting the study, because the true preference is normally unknown. If you replicate your DCE task, you'll be easier because you know how roughly people's preference. If it's new product, it's very difficult. So there are some guidelines as well, tell you how to calculate the sample size. There are some experience we can learn from the literature on how to make the choice task more attractive and easier for respondents as well. For example, to allow some overlapping attributes or to use color coding, so such that people can see the difference more easily. If you're looking at number A versus number B, we can see some difference clearly, which will be always helpful for respondents. And I never forgot using the pictures, because pictures sometimes it's much easier to understand than numbers. For example, in this example, when people showing delay to start treatment, or especially the concept relating to percentage, the risk, sometimes with a dollar, the money, the cost, some of the pictures will be very helpful for the general public to understand what you are referring to. In particular, from my experience, something to do with risk, percentage, all those things with the figures, it becomes much easier. So owing to the time, I think I will not go to very detailed further, but just to show that there are some of the important guidelines for how to analyze the data. So that is already in step 8 when we showed the previous flow chart. So similar, this guideline tells you what to consider, because we can consider everyone in your sample has the same preference, homogeneous preference, or people may have different preference. Some people, well, you wouldn't as simple as, for example, let's say by gender, males and females will have different preference. It can be more complex than that. So there will be techniques that help you understand the preference heterogeneity among your respondents. So all these guidelines I'm showing here talk about all those issues. And in their electronic materials, they always have code and the data set for you to practice. So those are the things are really helpful for us as users for the discrete track experiment. I think that I'm almost already reaching the 1 hour time. So originally I have thinking about maybe using one example, but I think I will skip that because this all those things I mentioned is already in the materials I show on the screen. So you can easily go back to these papers or go back to these textbooks to see how best to analyzing the track experiment. Overall, the key thing, as I mentioned a bit earlier, is the key thing is only one equation, is U equals to V, where you observed from the DC, where you show the respondent, plus error term that is you are not showing the respondent, but will influence your decision making. So just keep that equation in mind will be important. So I will skip to a few final resources. I think it will be good that I will mention that. For example, like this book, Mandy Ryan, based in UK, she is another leader in this area, in particular for healthcare using discrete track experiment. So this is one of the very good textbook. In fact, I think it's publishing around 2008, around that time maybe, but it's still one of the classical books that we can use. It has very good examples, the codes for people to see how to use, how to analyzing track experiment. So still highly recommended textbook. I will not go to the examples today, which in brief, I just shows how to do the utility, how the utility function, the equation will be applicable in the real life. So for the final probably 5 minutes, I will list a few other resources. So you can go back and to go through more details if you like. The software is one important thing for us because design, for example, beginning with the design is not as simple as we randomly putting a few scenarios. We can do that easily for pre-testing, but to do the main study design is much better that we follow a particular type of design methodology. And a lot of softwares that can be used for DC design, such as SAS, SPSS, R, Stata, or the one I'm showing here is one that I personally more frequently use is Engine, which is in particular a software for DC design. I feel my feeling is it's very convenient and it's very advanced for you to do more different type of design. It has a very detailed menu. It's freely available regardless whether you purchase the software or not. It has very detailed examples on how to generate the design. So that would be the example syntax that you use to do the design. And it's very similar to the thing that as soon as you know how to write down the utility function, you can easily do the design and you can do the analysis in the next step. After we design the DC, we need to put it somewhere, or we just print out as a hard copy, doing face-to-face interview, or let them to post back. That's another thing we can do. Or nowadays, owing to the COVID, we're more likely to use online to experiment. There are many of these platforms. Portrait is one that we commonly used at Monash, partially because it's free for us. So there's the license between university and the company. But it does have a free account as well. And it supports multiple languages. So this screenshot just shows what they do. You can see the track experiment on your mobile phone, or on the tablet, or on the desktop. So it can all show. So that would be one software we commonly use, but there are many of similar online experiment that can hold for your experiment. When going to the analyzing that, the Unlogit is one software that has been used very similar to the engine software. It's using pretty much a similar language. So if you know how to use one, it's easy to transfer to the next one. So Unlogit is one in particular for analyzing the limited dependent variable, such as, you have binary, you have an ordinary variable, such kind of regression analysis. It is one of the popular software in this area. It's very capable of doing all different types of advanced methods. Some of those methods are supported by state, some are not. But to be frank, I think state and R is become really popular and advanced in analyzing DC data set. So pretty much everything can be done in Unlogit now can be done in state in the most recent version of state or by the R package. But I still think it's good to know there is this particular software. Again, it has a very detailed handbook, more than 800 pages. This is just one part of the handbook, where it's very detailed documentation on how to do it, how to interpret the results. So from the very beginning, you may use engine for design. And then you put the design on the Qualtrics, so you can start collecting data set, and you can put into the Unlogit for analyzing. But these are not the only software. I mentioned state are a lot of other software can do everything. Or, if you have some professional online platform, such as Sawtooth, which can pretty much conduct everything from the very beginning, the design, to data collection, onto the final statistical analysis. You can cover everything. Of course, it's not a free software, so you need to pay for that. So these are just some of the popular things I personally use more often. Yeah, I think I'd like to stop quickly. Just a few textbooks that has been play a quite important role for us to learn DCE, and all those textbooks has very detailed examples and interpretations. So it's very handy. The final thing I want to mention is International Academy of Health Preference Research, IAHPR, is one of the professional organizations in this area, in particularly. And one thing for the users is that you're not only holding the meeting information, it's a very professional organization. So to join that, you need to be successfully present the papers there. So it's all peer reviewed. It also has one of these registries about all the DCEs. So if you're thinking about conducting DCE and you're thinking about to see whether this has already been done or whether what other people has done, you can go to the registry just to search, type in the keywords, and you can see who has done what DCE in health preference research. So it's very interesting. It is not mandatory, so it's voluntary. The registry is growing at the moment, but it will give you an idea what topic has been used. And finally, there's an annual international conference. So this year you'll be in Berlin, Germany, and the next year we hope to bring to Asia Pacific region. We at the moment thinking about to Australia, to Adelaide. So we really welcome to all the audience for our encouragement to submit the paper and to present in the academy in the annual conference. So that's all for me today. Sorry that I think I passed a few minutes already, and thank you for your attention today. And any questions are very welcome, not only today, but afterwards. Rowan and I are more than happy to provide more answers and yeah, any potential collaboration suggestions. Yeah, thank you.
Well, thank you very much, Dr. Chen, for such wonderful presentations. And you also has presented several resources, including books, softwares, and the most important thing in the last slide were conferences that would be held this year in Germany and next year in South Australia, Adelaide. So they will have plenty of time to do some DCA study to practice on this and present in the next conferences.
Yes, yes, very welcome. And it's very, I think, a previous experience is very friendly conference. Well, each time I attend, I learn a lot. So highly recommended it.
Thank you. Any question from the floors, from the participant online? There's a question from Professor Ridwan. Would you repeat, please explain again about the attributes and level? So the attributes is the characteristic that we would like to emphasize, and then level is that the level is the types of alternatives that we provided, or could you give me some explanation about the attributes and levels?
Yes. Well, just probably let me unshare my screen so I can see everyone.
Yes,
Because
I was in the second screen, I think. Yeah.
Yeah, I will just unshare so I can see everyone. Yes. Okay. Thank you. Attribute and levels. Yes. So the levels is underneath the attributes. So attribute itself will be the key characteristics that we were thinking about, but it can be described in different levels. So let's say health. If we're thinking about my mental health day, let's just say depressed or happiness. Or happy. How happy I am? Very happy. Happy. Neither happy, not unhappy, or unhappy. So all those things are describing a particular attribute will be the level. So the how happy you are, those are the levels, and the attribute itself will be, for example, whether I'm happy with my health today. That will be the attributes. So both are very important to be considered. If you're including quite a few not important attributes, for example, people may get tired, and in the meantime, you will see a lot of insignificant results later on, because those are the people that doesn't matter. On the other hand, if very important attributes has been omitted, the results you're going to produce may also be biased in the real life. So that's also the things we need to think about is what are the key attributes you have in mind? What are the key attributes that answering what kind of questions? Yeah, so there's a lot of work to be done on this area on attribute and the levels.
Can I
Yeah,
add
go ahead.
Pakancha? So the collaboration that Pakancha, Gang, myself, Indra, I think Ibu Jumriani, he's here, have been working on. We did a lot of work doing, where our DCE is looking at community upgrading for informal settlements.
Yeah.
We did a lot of work doing focus groups with residents who live in some informal settlements in Makassar to talk to them, to find out what were the most important things that they wanted in community upgrading. And so, yeah, that was a really important stage in developing what attributes to include in our DCE.
Yes, and then when we talk about the alternatives, say different type of alternatives, is there any experiences how many alternatives that need to be provided? And going back to the previous question, whether alternatives should be in the real situation or in a hypothetical alternatives. I mean, what's your experience on doing this?
Yes, in more health-related DCEs, we normally see two alternatives in one experiment, A or B. That's more likely we see. Sometimes we have the third one is to say none of the above for people to opt out. It's quite interesting if we're looking at the marketing or the management literature, then only showing two alternatives, they will think it is really less efficient. So they will show more alternatives. So I would probably think at least 3 alternatives to the respondents. Because when finishing each task, you will have more data set. You'll create more data. But the alternatives itself can be also difficult to for each respondent to digest in each task. They need to think about the comparison between A and B, B and C, probably A and C again. So it's kind of the trade-off. Again, we probably sometimes do a pre-testing to see how many alternatives respondents could handle each time before they feel a little bit fatigued, maybe. But normally, I would think 3 wouldn't be any problem. And to what extent that should be realistic to the real life, it is a question. You wanted, for some questions, you wanted to provide some levels that goes beyond the current situation. So that's where you can test it, what happens in the future. But in the meantime, if a lot of things are unrealistic, then respondents will be not taking it seriously. So either we need to explain to them, this is about the future things might happen in the life, to at least let them know that we are serious about research. That will be helpful as well. For sometimes a new vaccination, for example, even before the COVID-19 vaccination being available on the market, a lot of times you don't know the attribute levels and what will be the best attribute levels. So in that scenario, you probably will potentially also put in some levels that you don't know yet whether that works. For example, how long will you protect you? You might put 1 month, 6 months, 1 year, which before the real life evidence shows up, you don't have a very concrete evidence. But those things will be able to test and to understand if the vaccination comes out, to what extent people will be comfortable with.
Thank you very much. Any question from the online participants? Ada pertanyaan dari partisipan yang ada secara online? Bisa langsung bertanya, bisa dalam bahasa Indonesia atau bahasa Inggris. Nanti kalau dalam bahasa Indonesia nanti saya bantu translate. Ada pertanyaan? Saya cek dulu. Ada pertanyaan?
I think, is there one, you might have asked this, I'm trying to Google translate. So again, the attributes and levels that are chosen, some of them look like they are about individual preferences, and some might be a mix of benefits or levels that affect the individual, but also society. Can they be mixed, or is it always about an individual's preferences or benefits to the individual, or can it be also benefits to society?
Yeah, good question. I feel that could be mixed, but it does depending on what will be your research question or research aim to achieve. So it potentially can be mixtured. Yeah. But I don't have a very direct example to show here. Yeah.
I guess one example in our DCE with UNHAS is attribute is frequency of flooding or water interruptions, water supply interruptions to the household is one attribute. So many interruptions and no interruptions would be the levels. But then another attribute is diarrhea risk to the whole community, with high risk of diarrhea transmission, medium risk and low risk. And so that DCE has a combination of potential benefits or attributes that affect individual house and also a societal benefit.
Yes, good point. Yeah.
There's one question in the chat. Is there any limitations of DCA?
Yes, there are actually.
But the findings, limitations are, so that we can able to interpret the findings.
Yes. So, for example, we know a lot of times we're using hypothetical scenarios, and that's not. And also, when people making the choices, it is a stated preference. They say they're going to prefer this one. Well, does it mean in the real life they're actually going to do that? It can be quite different in the real life. So to what extent the results or the findings from the DC part can be externally validated in the real life? I think that is quite an important research area or research agenda. We know from the literature, at least, some of the public health interventions, they have trying to externally validate the DCE findings. And for the papers, on top of my head, they found around 80% of accuracy that the results being predicted from DCE is what you see in the real life. So there are some room for error, but to a large extent, the findings is meaningful to the real life. Yeah.
Well, thank you. And just to let you know that currently there is a discussion around Indonesia about related to COVID about self-tests, where previously government only allow you to do to perform tests in the accredited clinics, but then the government now from the people, whether people could do their own tests and just report it. And a lot of alternatives. I just thinking this one of alternative where maybe DCA can also be involved, including the vaccinations that have been implemented here in Indonesia. And if there is there are students who are also involved or would like to use this method and so would like to use this method more in deeply, I hope both of you are able to provide assistance to do this.
Yes, sure, no problems. I think Rowan and I will be very happy to contributing to.
Perfect. Thank you very much. Masih ada lagi dari mahasiswa? Ada peserta yang mau bertanya terkait dengan discrete choice experiments, bagaimana memilih alternatif, apa yang harus diperhatikan, softwarenya apa, dan seterusnya. Well, it seems there is no more question from the participants, and then we already for 1.5 hours. On behalf of the School of Public Health and the participants, I would like to thank you for both of you, Dr. Cheng, Dr. Rohan, and we hope we'll do the analysis later based on the findings in the RISE study, where we can practicing in analyzing the data, and of course in the publication later. And we could also do started to discussing a couple of potential collaboration in the future, because we understand this is for the most of the researchers here, we haven't got any experiences previously with this method, but I could find there's a potential using this method in the future. Again, thank you very much, Dr. Rohan and Chen, and looking forward to a future collaboration and waiting for you here in Makassar.
Thank you.
Thank you, Profesor Gan. Thank you, Rohan.
Ya. Indra, acara berikutnya apa lagi ya?
Workshop tapi untuk tim kecil saja, Pak.
Ya, jadi setelah acara ini akan ada workshop khusus ya bagaimana menganalisis datanya karena ini agak teknis. Ada beberapa tim dari FK Munhas, Pak Indra, Ibu Jum, kalau tidak salah ada beberapa orang yang akan dilatih khusus oleh Dr. Chen dan Dr. Rohan menggunakan software supaya ini bisa dilakukan supaya nanti mereka lagi yang melatih kita. Tapi Dr. Chen dengan Dr. Rohan ini insya Allah akan sering ke Makassar. Ini sayangnya karena pandemik saja sehingga beliau tidak datang, tapi sebelumnya sudah beberapa kali datang ke Makassar dan akan datang lagi kembali untuk melakukan beberapa penelitian dan kolaborasi di masa yang akan datang. Thank you very much, and this is the end of the seminar. Thanks all for the participation, and yeah, looking forward for the next public health seminar. Yes, and I will move to the next session for the small group.